Though many are diagnosed with breast cancer, for quite a while it has been unpredictable. My grandma had breast cancer, and a few years later she had a reoccurrence of the cancer in her brain. Slowly, our treatment process has gotten better, but it is not perfect. A family friend who had also had breast cancer has been using methods to try and lower these chances. I believe that because of researchers' studies, this good friend has a higher chance of avoiding these sometimes deadly reoccurrences. Breast cancer is an invasive tumor that begins in the cells of the breast. This specific type of tumor can grow into surrounding tissues or spread to faraway places, such as the brain. This disease happens mostly in women, but a man can get it too. An important thing to remember is that there are two types of cancer, invasive and non-invasive. Some cancers stay in their part of the body. Breast cancer is not like that. It is very possible that if a breast cancer tumor is treated incorrectly, it can and will spread. If you have breast cancer, you may have many options for treatment. These include surgery, such as a mastectomy, radiation therapy, chemo, and hormone therapy, also known as targeted therapy. Methods used can vary based on the progress of your tumor. Our first patient story, which is told to us by her husband, is about a woman named Diane. She was diagnosed in January of 2006 with breast cancer in her right breast. During the time she had breast cancer, it also spread to her lymph nodes. The second patient, Katie, found out about her cancer in 2015, also in her right breast, and it did spread to her lymph nodes as well.
I know it was fairly radical breast cancer in that she had a mastectomy in her right breast, and had very toxic chemo.
Mine is it's a HER2 new triple positive.
Both Diana and Katie went through 3 of the most common types of treatment: chemo, radiation, and mastectomy. The differences in their treatment are in the advancements that have been made from 2006 to today.
Lethal cocktail that they would give her, and then 4 or 5 days later they'd give her a whole bunch of stuff that would build back her white blood cells, and then she'd have 2 weeks, and then they go in and do it again. It was the cocktail was about 1.5 gallons of stuff, 3 different medicines, you want to call them medicines, and I think they called it TAC. So it was probably TAC, whatever the T and the A and the C stood for. It was all
6 treatments of chemo, which I had every 3 weeks, and which the drugs for that were Taxotere, Cytoxan, Perjeta, and Herceptin. And Perjeta and Herceptin, having those combination together prior to having surgery and taking the cancer out, increases my chances of survival, which is great. Without those, my chance of getting cancer again is 80%. With those, my chance of cancer again is 20%, which is a big difference. So I had chemo, and that was about 4 months worth of chemo. And then I chose to have a bilateral mastectomy, even though I only had cancer in one side, my right side. And a full dissection of the lymph nodes on the right side, because my lymph nodes were compromised as well. And then 6.5 weeks straight of radiation.
Although Diane and Katie's breast cancer were very similar, Diane had to have a lot more treatment than Katie had to. Diane's treatment, for one, was a lot longer because of the weaker treatment they had. Her treatment was about 1 year long, where Katie's was about 6 months. In the past, reoccurrences were unpredictable, and for Diane, it came back. Katie, knowing this, did her best to lower her chances of reoccurrence. People are constantly finding new ways to treat breast cancer. Katie is a wonderful example of how advances in breast cancer treatment can increase your chances of survival and lower your chances of reoccurrence. Though, from 2006 to today, we have only made small steps, we have greatly improved and are working on new ways to cure it. Perhaps in 20 or 30 years, cancer will be completely eradicated.